right, let's get started. Whether you are 3 days postpartum or 30 plus years postpartum, if you need to reconnect with your core, this program is for you. I'm so excited to get started. So the first exercise we're going to do is called side lying diaphragmatic breathing. So you're going to start out by lying on your side, and you can just do this in bed. Our first week or so is going to be pretty relaxed, just trying to reconnect with our breath. So you're going to have one hand on your belly. Try and breathe in through your belly and back out. When you breathe in, you want your breath to go down into your stomach and into your lateral ribs. So we want to avoid this upper neck breathing motion that we probably got into the habit of during pregnancy because baby was in the way. Now that baby's not in the way, we want to reconnect with that breath and really lengthen into our stomach, get that diaphragm working, and that'll also help loosen up your pelvic floor. So taking that deep breath in and back out. Let's do 3 more. All right, next we're just gonna add in an abdominal contraction. So when you breathe in, your stomach muscles are lengthening. So we're gonna take that deep breath in. When you breathe out, you're gonna try and draw your belly in towards your spine. So taking that deep breath in, breathe out, draw in. And when you draw in, you don't want to have like a puckering down here or have that feeling of bearing down or increased pressure into your pelvic floor. It's a very gentle motion, just trying to fully relax. Take that deep breath in through your belly, breathe out, and just tighten those lower abs. Let's do 2 more together. When doing this exercise, you don't want to pull in so hard that like I said, your stomach starts popping out, because then we're not really getting that deep inner core muscle that we're targeting. A lot of times if we do too much effort, then our outer core muscles start taking over. Your pelvic floor and your transverse abdominis, which is the 4th layer or the deepest part of your abdominal muscles, are very tied in together. So helping to activate this transverse abdominis will help kind of start engaging your pelvic floor. So let's do 5 more breaths with the transverse abdominis contraction together. So taking that deep breath in and out. And out. And out. Deep breath in and out. One more time. Deep breath in and out. Next, I want to go back to that side-lying diaphragmatic breathing. So we're staying in our side-lying position, but this time I want you to have your hands on your ribs, your lower rib cage. So kind of find down in your ribs here, and then you're just going to come right above that. When you're pregnant, a lot of times your ribs expand forwards and sideways and kind of flare out to help make room for the baby. Afterwards, this doesn't always just like come back together on its own, which might be why you've noticed that your bra size increased around your ribs. So your cup size might have increased because of breastfeeding or pregnancy or hormonal changes, but your rib bra size, I don't know what exactly they call it, might have also increased just because of that rib flare. So let's have you so to bring that back together, you're going to have one hand on your side, take that deep breath in, trying to expand through your belly and lower ribs, and then on the exhale, you're going to give yourself a little bit of overpressure, and then breathe back into that hand, in and out, giving yourself a little bit of overpressure. One more time. Breathe in and out. Let's do this on the other side because your ribs flared both directions. So you can just flip over in bed and same thing, find your lower ribs here. Rest your hand on top. Take that deep breath in. Breathe out. Push down. One more together. Breathe in and out. The next thing you're going to do is lie on your back. And while you're lying on your back, you can just take a pillow and put it in between your knees. And all you're going to do is take that same breath in. And when you breathe out, you're going to just squeeze your knees together. Breathe in and breathe out. We're starting to work your hip adductors, which are the muscles that bring your legs together. These muscles tie into your pelvic floor. So by activating your adductors, we're helping kind of stimulate that pelvic floor to wake up and start working again. Let's do 5 more here. This is also a really good exercise if you have any pain in your pubic bone. Let's do one more. Good job. All right, you can put your pillow back where it belongs, and then you can sit up in your bed just a little bit. And we're just gonna do some ankle pumps up and down. This is really good just to kind of get that lymphatic system moving. Pump out any swelling that you might have postpartum. Or just get your circulation going from a lot of sitting or lying with baby as you've been recovering. Even if you're years postpartum, this is just a really good exercise to promote blood flow to your whole leg. Can do circles. Eight, 9, 10, and then let's reverse 10 the other way. All right, the last thing we're going to do is just sit up and do some shoulder circles. If you've been spending a lot of time breastfeeding or bottle feeding your baby, a lot of times your neck and upper back get tight. Or if you just spent a lot of time on the computer or doing the dishes. Or doing a hobby that requires you to look down. This might get tight. Let's go forward again. And backwards 10 more times. And we're going to do some neck circles. Just do 5 each direction. And switch. Got some little crunchies in there. Which any like popping or crunching, as long as it's not painful, is okay and can be normal. Probably just means that you need to get a little bit more lubrication in those joints, which movement is the best way to do that. And now I lost count. Once you did 10, you can be done with that. Thanks for joining me for your first day of your postpartum recovery.